I want to send this message to the parents. And I mean parents, I mean those that have children. So listen to this video to learn a lot about drugs. I've just come to realize that the way some of our parents are raising their children towards antibiotics, they are very terrible. They are very terrible. And that has caused a lot of problems to so many children now. I've just noticed that sometimes some of the parents, because of the way they feel that they love their children. So once the children is having fever, the next thing is to give the baby antibiotics. Once the baby is coughing, the best thing is to give the baby is antibiotics. Once the baby is having even diarrhea, the first thing is to give the baby is antibiotics. And some of them, they don't know the implication of what they are doing. It's very terrible. And I want to open your mind. I don't want this video to be long, but I just want to open your mind a little so that you learn and know, understand the implication of what you are doing to your baby. One of the things you need to understand is that some people body system needs some antibiotics, some bacteria. So and while you are growing, some of these bacteria that are good for the body, you can even lead to the death of so many of them. Let me talk about the gut floras. You understand, gut floras. So sometimes when you expose the baby, research has shown that once you expose the baby at early age, you can alter the gut floras. You understand? You can kill some good bacteria. You can kill some of them. You can wipe them away with antibiotics. So you understand? So it's not advisable to give the baby, expose the baby at early stage. Now, it can also lead to decrease in immune system. It affects immune system of the baby. You understand? So giving the baby antibiotics too early can affect the baby's immunity. The immune system will be jeopardized. Now, research has already shown us that giving a baby antibiotics too early can even lead to what we call, can lead to even asthma. Yes, can lead to asthma. And it's very bad. Now, I want to talk another one, the major one, which is what? Antibacterial resistance. Now, that's why sometimes you see some baby that you see, this baby, anytime she's having fever, or anytime she's having fever, the next thing again, you pack maybe give the person amoxicillin, you give ampiclos, and you notice that when you give the ampiclos, it will heal the baby will not have fever again. Or you understand? Or the baby is having cough, you give antibiotics, you give, some people usually give azithromycin, they give amoxicillin, they give ampiclos. These are the three drugs they usually give, or flagyl. So you pack the baby with all these antibiotics, any of them or two of them, say sometimes they used to combine two of them. So when they pack it to the baby for the first time, the baby will be healed, the fever, all these symptoms will go. Then the next one again, the baby start feeling the same sign again. You give the baby exactly the same thing you have given the baby, and suddenly the thing did not work. So do you know why? This is one of the reasons why so many people are buying in the hospital without knowing it. This is what we call antibiotics resistance, antibacterial resistance. So antimicrobial resistance. Now I'm talking about only antibiotics only in particular. So what it does is that when the body system develops resistance to that particular drug, for instance, now if you're taking an amoxicillin, and one of the things that can cause this thing is that sometimes they don't take it the right way to take it. Either they take underdose or they take overdose. You see some parents, they'll just be pumping the baby with the drugs. They'll be pumping the drugs. What is happening? I just give the baby ampiclos. Within 3 hours that the thing did not work, they give amoxicillin. If it did not work, the next thing they give flagyl. They keep pumping the baby with antibiotics. Thereby, one, affecting the immune system of the baby. Thereby, can lead to other health challenges. Do you know it can lead to obesity? The baby will be obese because of the antibiotics that are pumping with the baby. Then the major one is antibacterial resistance. Now, the worst problem is that the thing that people don't understand, that amoxicillin that you are giving the baby, that the baby has developed resistance. Tomorrow, the baby will develop resistance, maybe another flagyl, maybe ampiclos, another things. Then, when the baby becomes sick and you take the baby to the hospital, the doctors or the whole health professionals will be confused and they will be frustrated because they cannot give the baby anything. Giving the baby the drug that's supposed to heal the baby is supposed to be maybe flagyl, but because the baby has developed resistance to flagyl because of the too much exposure to the flagyl, inappropriate exposure to the flagyl, they cannot give the baby the flagyl because the baby has developed resistance to the flagyl. Take for instance, it is azithromycin. The baby has already developed resistance to azithromycin. So you see now, you have already exposed the baby to a very terrible situation, and then the healthcare professionals will just be looking at the baby, and the baby may die because of your carelessness in the name that you love the baby, you don't want the baby to be sick. And sometimes some of us that are parents, when we look at our children, we just want to pack this one. You are giving the baby Piriton, you are giving the baby cough syrup, you are giving the baby azithromycin, you are giving the baby flagyl, you are giving the baby vitamin C, you are giving the baby only one baby. And when you finish packing all these things, you don't know that it is the liver that is still underdeveloped. The liver that is still developing small is what we are giving work over work, and then the liver will be working to eradicate all these things, because it's liver that is responsible for all this detoxification. So the liver that is still developing, that is still at small age, you are pumping all the baby all these things, thinking that you love the baby, while the liver will be failing. Liver at the age of 10 too, the liver is already failing because of the fact that you're already overworking the liver that is still developing. A baby of 2 months, 3 months, 4 months, 1 year, 2 years, you're already packing. In the morning, you bring box, first aid box, you start pumping the baby. Even if the baby did not develop antimicrobial resistance, the baby you can damage the liver of the baby. That is the truth, but you don't know it. Drug is not food. They say drug is poison. All drug, including paracetamol, is poison. Including vitamin C, is poison. You don't know. All these things that are poison, if not taken, if when you are taking it in the wrong way. Do you get it now? That's why those people that develop the drugs usually tell us that every drug is a poison. Every drug, including the ones that you think that it is safe, including paracetamol. In fact, paracetamol is a deadly one. Paracetamol is a deadly drug that you don't know. People take it for granted. Paracetamol is it's hepatotoxic. It affects the liver. But anytime when the baby is having fever, yeah, they pump the baby with paracetamol. Give him paracetamol, give him paracetamol, give him paracetamol so that the fever will go. They will keep pumping the baby with paracetamol. Something that they're supposed to just, if you have consulted a good professional health caretaker, the person will just tell you what to do and the baby will be fine without taking even drugs. Even if I thought they will give the baby drugs, it will be at the appropriate quantity and the baby will be in good health. So please, so what are the things you need to do? Once your baby is sick or is having any symptoms you don't like, the best thing to do is to consult your healthcare professional. You consult your doctor, you consult your pharmacist, you consult people that know better than you. Don't just be doing it because you don't love that baby. You are exposing that baby to a very terrible situation, especially the liver. Remember that as a small baby, the liver is developing. All the body system is developing. The immune system is maybe high. But you trying to compromise all these things, you are trying to destroy the baby. So please, don't just rush. I've seen some of our parents. It's not. I've seen one small girl. We have seen a lot of things. I've seen one small girl, a baby of 2 years. If you see, when the mother brought the baby, guess what? They're already exposing this baby to herbals. I told the mother, how can you be exposing this small baby of a year and 6 months to herbals? She told me that is what is working. That's what anytime they give the baby herbal and the baby will be fine. But now suddenly the thing is not working again. I say, what kind of mentality is this? Please, to the parents, please be careful the quantity of drugs you give to your people. Don't just give. Paracetamol is not safe. Paracetamol is more deadly than even azithromycin. That is the truth. Paracetamol is more deadly than even flagyl, if you don't know. Please, help the baby, please. Stop packing the drug. You're giving the baby ibuprofen. You're giving the baby paracetamol. You're giving the baby flagyl. You're giving the baby cough syrup. You're giving the baby vitamin C. You're giving the baby multivite. You're giving the baby B complex. Only one baby. Remember that it is still liver that work all these things. That will detoxify all these things. That liver that is still at developing stage. So the person can develop antimicrobial resistance. The person can have liver damage. The person can have immune compromise. The person can become obese. That's obesity. Because of all these things. The person can develop allergic reactions. Asthma. The person can develop asthma because of the drug you're giving to the patient. Allergic reaction. The person will do because of the person will react. Please consult your healthcare professional so that the person will teach you what to do for your own safety and for the safety of your children. I pray you will adhere to this instruction. Thank you very much.